Hello, everybody. I'm talking about long-term use of Ticagrelor in patients with prior myocardial infarction. One definition. Ticagrelor is a medication used for the prevention of stroke, heart attack, and other events in people with acute coronary syndrome, meaning problems with blood supply in the coronary arteries. It acts as a platelet aggregation inhibitor by antagonizing the P2Y12 receptor. A heart attack happens when one or more areas of the heart muscle don't get enough oxygen. This happens when blood flow to the heart muscle is blockaded. Applications in medicine. 1. Ticagrelor is used to prevent a series of life-threatening or heart attack or stroke or death in people who have had a heart attack or who have acute coronary syndrome. 2. It is also used to prevent blood clots from forming in people who have received coronary stents. To treat ACS, ticagrelor is used to decrease the risk of a first-time heart attack or stroke in people at risk with coronary artery disease. 3. It is also used to decrease the risk of another more serious stroke in people who are having a mild to moderate stroke or a transient ischemic attack. And 4. Finally, ticagrelor is in a class of medications called antiplatelet medications. It works by preventing platelets from collecting and forming clots that may cause a heart attack or stroke. Pros and cons. Pros: rapid onset and offset of action, reversible platelet inhibition, greater efficacy than clopidogrel, bleeding risk comparable to clopidogrel, and mortality benefit. Cons: expensive, twice daily dosing, dyspnea and ventricular pulses, higher non-cap related bleeding, and higher withdrawal rates. Is applied in Ecuador. The secondary prevention study of acute myocardial infarction in Latin America has among its objectives to identify cardiovascular risk factors and describe the pharmacological treatment used for the secondary prevention of AMI. Cross-sectional study data from phase 1 at the study in 5 hospitals from Quito, Ecuador, period March 2003 and December 2005. 264 patients with a first AMI show as main cardiovascular risk factors. 1. Sedentary lifestyles. 2. Decreased HDL. 3. Age at risk, smoking and hypertension. And finally, hypercholesterolemia and diabetes mellitus. Opinion: overweight was significantly more common than obesity. Patients with current smoking were more frequent than former smokers. The cardiovascular risk profile in Ecuadorian patients has some difference in relation to other countries. The nutritional characteristics of the population and sociocultural factors could explain these variations. In conclusions, long-term ticagrelor reduced thrombotic events in patients with prior ME, regardless of whether they have prior coronary stenting. This data highlight the benefits of TAP in prevention of spontaneous atherothrombotic events and indicate that long-term ticagrelor may be considered in high-risk patients with prior AMI, even if they have not been treated with stenting. Finish. Thank you.